The antispasmodic drugs reduce muscle contraction in the GI tract. This decreases cramping, bloating, and diarrhea. These drugs are typically combination drugs that affect the autonomic nervous system and the CNS. Antispasmodic drugs are used primarily to treat symptoms of the irritable bowel syndrome. They can also be used to treat acute inflammation of the small bowel and colon or duodenal ulcer. Examples of this drug is scopolamine, also known as Donatol, and phenobarbital. In the nursing implications, teach the patients that they should not use contact lenses while taking these drugs because they can cause dry eyes, blurred vision. The drugs decrease GI motility and should not be used for infectious diarrhea. Make sure that you monitor the patient's vital signs carefully because the drugs can cause significant changes in the heart rate, either bradycardia or tachycardia. The drugs are not recommended for older adults because they can cause confusion or other adverse effects at even low doses. See nursing implications for anticholinergic drugs. These drugs contain atropine, which is very drying. The most common side effects of antidiarrheals are nausea, vomiting, dry mouth, and of course constipation. Some other side effects are dizziness and drowsiness. Anticholinergics have many drug interactions. Opioid agonists may interact with other opioid drugs to increase the opioid effect. Many of these drugs are combination drugs, so be sure to consult your nursing reference book before giving them. Some general nursing considerations for drugs for diarrhea: to make sure that you wash your hands between contacts with all patients, wearing gloves when directly caring for patients, following agency protocol to determine the need for isolation of patients, never give any type of antidiarrheal agent to a patient with severe abdominal pain, nausea, and vomiting or fever unless that patient has been thoroughly assessed by a registered nurse or healthcare provider. These symptoms may indicate a serious illness. Assess the patient's normal bowel pattern, including frequency, consistency, and regularity. Ask the patient about any underlying health conditions that may be causing the diarrhea. Check the patient's drug history because many drugs, antibiotics, laxatives, statin drugs, lithium, and NSAIDs have diarrhea as a side effect. Remind the patient to include over-the-counter and herbal drugs on the list as well. Determine whether the patient has cramping or abdominal pain with defecation. Monitor stools for color, consistency, and presence of blood or mucus. If blood or mucus is present, report it to the registered nurse or healthcare provider. Report fever, abdominal distension, or severe pain to the registered nurse or healthcare provider. Track intake and output, daily weight, and help prevent dehydration. Give oral or IV fluids to replace fluid losses from diarrhea. Maintain adequate nutrition, including complex carbohydrates, such as rice, toast, and cereal, as tolerated. Teach patients to avoid alcohol or other CNS depressants while taking these drugs. Special consideration should be given to older adults and children because of their increased risk of dehydration. Symptoms include orthostatic hypotension, increased heart rate, poor skin turgor, and decreased urinary output. Monitor laboratory values for changes in electrolytes, particularly hypokalemia. The patient and family teaching is important for the patient to understand to take the drug exactly as the healthcare provider has prescribed it. For the patient to notify the healthcare provider if there are any new or troublesome problems that occur, especially if increased abdominal pain or fever is associated with the diarrhea. The antidiarrheal drugs are used to relieve symptoms and to prevent dehydration until the underlying cause can be found and treated. Diarrhea that persists for more than 48 hours should not be self-treated. Return to the healthcare provider for further evaluation and diagnosis. Some antidiarrheal drugs contain habit-forming drugs, and they should be used only at the dosage recommended for the length of time prescribed. Diarrhea or loose stools should not last beyond the expected or intended time frame. If it lasts more than 48 hours, a healthcare provider should be consulted. Parasitic infections. A parasite is an organism that can survive only by living in or on a host organism. Billions of people worldwide and millions of people in the United States are affected by parasites that cause serious illnesses and can even cause death, especially in immunocompromised individuals. Parasites can be picked up from food, water, or insects and can be transmitted from person to person. Three main classes of parasites can cause disease in humans: protozoa, helminths, and ectoparasites, fleas and lice. Protozoa, amoebasis, and giardiasis are usually contracted from food and water contaminated by feces or from unwashed hands after using the bathroom or changing a diaper. These infections reside in the intestinal tract, and common symptoms are diarrhea, abdominal pain, vomiting, and foul-smelling stools. Amoebas are able to invade other parts of the body if they reach the bloodstream, and they can cause liver abscesses. Toxoplasmosis is usually asymptomatic in a healthy individual, but can cause serious illness in people with chronic disease. It is contracted from contaminated raw food and water, or by handling contaminated soil, cat litter, or raw meat, and then touching the mouth, nose, or eyes. Helminths. When a patient has Helminth worms, the infestation is called helminthiasis. The condition is usually caused by flatworms, roundworms, tapeworms, or flukes. The worm gains entrance to the body through unclean food or water, unwashed hands, or the skin. Anthelmintic drugs are specific for the worms they can kill, and accurate identification of the worm is necessary. Identification is done by analyzing the stool, urine, blood, sputum, or tissue from the host to look for the larva or eggs of the parasitic worm. Antiprotozoal drugs work in several different ways inside the cell, affecting the function of DNA and/or RNA to kill the protozoan parasites. Antiprotozoal used to treat amoebas and Giardiasis, Toxoplasmosis, and Trichomonas are metronidazole, known as Flagyl. Metronidazole is also used to treat bacterial vaginitis in conjunction with antibiotics used for the treatment of pelvic inflammatory disease. Again, an example of this drug is metronidazole, known as Flagyl. In the nursing implications, the patients are taught to swallow metronidazole extended release tablets whole, not to crush them or break them or to chew them, because that releasing the drug too rapidly leads to adverse effects. Giving metronidazole at least 1 hour before or 2 hours after a meal to ensure the best absorption. Advising patients to take metronidazole with a full glass of water to support the excretion by the kidney. Check the patient's baseline liver and kidney function, laboratory results, and making sure to alert the healthcare provider if there are any abnormalities, because this drug is metabolized by the liver and is excreted by the kidneys. This drug can cause damage and compromise the patient. Remind patient taking metronidazole to avoid alcohol and alcohol products. Severe side effects could occur. Consult the healthcare provider and/or the pharmacist for patients that are taking metronidazole, because there are a lot of drug-to-drug interactions that could lead to life-threatening dysrhythmias. Patients taking metronidazole need to make sure that they understand the importance of finishing their entire course of prescribed medication as well. Anthelmintic drugs, praziquantel, also known as biltricide, are examples of these drugs that are currently being used to treat certain types of tapeworms, flatworms, and roundworms. They kill the larva by destroying the cytoplasm of the worm, not the host cells. This disrupts the cellular function necessary for the survival of the worm. It paralyzes certain kinds of roundworms. Praziquantel kills certain types of flukes and tapeworms by moving calcium into the cell membrane, which causes contraction and paralysis of the worm, dislodging it from the host site and killing it. An example of this drug is praziquantel, known as biltricide. In the nursing implications, inform the patient to take these tablets with food and a full glass of water to minimize the stomach upset. Warn the patients to check for the yellowing of the eyes, the darkening of the urine, and the light-colored stools, to make sure that they report any symptoms to their healthcare provider because this drug can damage the liver. Tell the patients with a history of cardiac dysrhythmia to contact their healthcare provider if they experience dizziness, irregular heart rate, and to call 911 if they experience chest pain, because this drug can cause cardiac dysrhythmias. All drugs used to treat parasitic infections can cause nausea, vomiting, headache, anorexia, diarrhea, or GI distress. Additional drugs may be warranted to minimize these side effects. Metronidazole, Flagyl, can cause peripheral neuropathy, as well as confusion. Fungal superinfections may occur with the use of metronidazole. Common side effects of drugs used to treat malaria are similar to those used to treat other parasitic conditions: diarrhea, nausea, vomiting, headache, and GI distress. Metronidazole increases the effects of warfarin, and serious bleeding can occur when the two drugs are taken together. Alcohol-containing drinks, food, or mouthwash taken with or used during metronidazole can result in severe nausea, vomiting, headache, shortness of breath, and hypotension. Disulfiram-like reaction. The patient and family teaching: take antiparasitics with or after meals to decrease the chances of stomach upset. Take antiparasitics with a full glass of water to prevent stomach upset. Report worsening symptoms of infections such as increased fever, increased fatigue, or anorexia. Take the entire course of drug even if symptoms improve to prevent relapse or worsening of infection. If taking metronidazole, avoid all forms of alcohol so that severe adverse effects do not occur. And when traveling to areas where malaria is common, take prophylactic doses as prescribed. Notify healthcare provider if expected side effects of nausea, vomiting, diarrhea, or abdominal pain cannot be controlled or worsen. When taking metronidazole for trichomoniasis or other sexually transmitted disease, refrain from sexual intercourse as ordered by your healthcare provider to prevent spreading the infection to others. Ask the patient about allergy to drugs, current use of alcohol or disulfiram, the possibility of pregnancy, and the existence of chronic renal, hematological, cardiac, thyroid, or liver disease. These conditions are contraindications or precautions to the use of antiparasitics and antimalarial drugs. Baseline laboratory tests should be completed before therapy begins. The planning and implementation includes observing the patient for any signs of allergic reactions such as hives, swelling of the lips and face, rapid pulse, or low blood pressure. Alert the rapid response team immediately if any of these symptoms occur because they indicate anaphylactic reaction. Monitor nutritional status and encourage adequate fluid and food intake to help fight infection. Monitor for super infections and notify healthcare provider of any changes. Assess vital signs as ordered daily and alert the healthcare provider of any changes, particularly in the temperature. Check the patient daily for signs of jaundice that may indicate hepatotoxicity, which is yellowing of the skin and yellowing of the sclera. Dark urine and clay-colored stool and abdominal pain. Check the ongoing laboratory work as it is ordered for any abnormalities that can indicate an adverse reaction or worsening of disease symptoms. Alert the healthcare provider as soon as possible if there are any change in the baseline levels. In the expected outcomes, after drug therapy, periodic laboratory blood and stool tests are required to make certain that the disease has been controlled or eliminated. The tests may be needed monthly for up to 1 year after therapy. Be alert to signs of drug toxicity. If severe symptoms appear, the drug may have to be stopped.